Along with the joys of bringing a new life into this world, you will also experience discomfort and some risks. Our hope is that this video will relieve the anxieties you may have about your pain management. The amount of discomfort experienced during childbirth varies between mothers. The degree of pain felt depends on several factors, such as the mother's pain tolerance, the size and position of the baby, the strength and duration of the contractions, and prior birth experience. Since no two labors are identical, your labor and associated discomfort will be unique to your body and your medical situation. Therefore, the choice of pain-controlling measures for you during your delivery may not be necessarily the same as that needed by others. Decisions regarding the control of your labor pain must be made specifically for you. Your obstetrician and anesthesiologist will decide with you what pain relief options will be best suited to your particular situation. Our goal is for your birth experience to be as comfortable as possible and to deliver a happy, healthy baby. Your anesthesiologist is a doctor whose training has been focused on relieving discomfort in the safest manner possible during potentially painful procedures. A certified nurse of anesthesia, CRNA, has specialized extensive training in this field and may be a part of your anesthesia care. What types of pain relief are available? Some mothers are able to achieve adequate pain control during their childbirth simply through breathing exercises and relaxation techniques. Many women are helped by techniques learned in childbirth classes, such as the use of positioning, breathing, relaxation, massage, distraction, and focusing. Some mothers, however, may find these techniques do not provide enough pain relief and may desire other options. Some prefer medications called analgesics, which are injected through a vein. These medications will dull or completely eliminate your pain. Local blocks also can be used, in which local anesthetics are injected into a specific part of the body to produce numbness. Finally, there is the choice of various regional anesthetic techniques, such as the spinal block or the epidural block. I'd like to spend a few minutes discussing these techniques and their advantages and disadvantages. Why discuss this now, well before your labor begins? We'd like to inform and educate you about the various available techniques. We feel it's far better to accomplish this in a more relaxed atmosphere before labor begins. Regional anesthetics block the pathway of painful sensations and keep them from reaching the brain. This is the reason for the term block. Regional blocks are provided to relieve pain during childbirth. An epidural, spinal, and a combined spinal epidural are the regional options during labor and delivery. An epidural block is administered by an anesthesiologist who is a physician trained as a specialist in pain management. During an epidural block, local anesthetic or other medications are placed into a space surrounding the spinal cord called the epidural space. Before the epidural injection is performed, an intravenous plastic needle will be inserted into a vein in your hand or arm so that your body will be adequately hydrated. The IV will be left in place throughout your labor and delivery, since you should not eat or drink anything until your child is born. Patients are evaluated by the anesthesiologist for epidural analgesia on a case-by-case basis. Patients with current conditions, such as bleeding disorders, spinal disease, nerve disease, potential heart or valve problems, infections, or morbid obesity may not be appropriate candidates for this procedure. For the actual placement of the epidural block, you will be either in a sitting position or lying on your side. You will be asked to arch your back like a cat or curl up like the letter C, with your chin down on your chest and your knees drawn up as far as you can comfortably. An area of skin will be cleaned with an antiseptic solution to help kill any skin bacteria. After examining your back, your anesthesiologist will locate the specific spot to numb the skin and perform the block. Then your anesthesiologist will advance a special needle into the epidural space. Through this special needle, a small flexible tube or catheter will be inserted and the needle will be removed. Occasionally during insertion, the small catheter will rub against a nerve and cause a very brief twitch or tingling sensation in one of the legs. After the catheter is properly positioned, it will be taped in place and can be used to give additional anesthetic medications as needed without any further needle sticks. Within 10 minutes following a dose of medications through the small catheter, the discomfort of the labor pains will begin to decrease. The pain will continue to decrease during the next 10 to 20 minutes after anesthetic has been injected. Complete and total pain relief may not be in the best interest of you and your baby, so small amounts of the drugs may be given initially. This means that you may still feel some pressure sensations with the contractions. The pain itself, however, will be noticeably diminished. In addition to the loss of pain, you may feel some numbness and heaviness or weakness in your legs. These sensations, of course, will pass once the medication has worn off. After the epidural catheter is placed, continuous medication may be given through an infusion pump, or periodic doses of anesthetic medication can be given through the catheter. Throughout your labor, you will be monitored carefully, and your medication will be adjusted based on your specific needs. Another method occasionally implemented in the labor and delivery setting is a combined spinal epidural. It is very similar to an epidural. This technique involves placing a small spinal needle through the epidural needle into the spinal fluid well below the level of the spinal cord. The advantage is a more rapid onset of pain relief. The most important question you should ask about these blocks is, are they safe both for me and for my baby? The answer to this question is that epidural blocks are quite safe for the mother, and they have little or no effect on the baby. However, special training and skills, as well as professional judgment, is required when an epidural block is used. For this reason, a qualified anesthesiologist usually performs this procedure. The most common side effects associated with this form of pain relief is a drop in the mother's blood pressure of varying degrees. Occasionally, this blood pressure change may require treatment with medication. It is for this reason that an intravenous infusion, an IV, is always used so that extra fluids and medicines can be given to stabilize the blood pressure. This is also the reason why, after any medication is given through the epidural catheter, frequent checks of your blood pressure will be performed. Shivering is another common reaction that can occur during labor and delivery, even if no anesthetic medications are received. Though uncommon, a headache may develop following an epidural anesthetic if the covering outside the spinal space is punctured during the insertion of the special epidural needle. To help avoid this problem, it is necessary that you hold very still during this procedure. If a headache occurs, the severity varies from patient to patient. It may last a few days and be controlled by simple measures such as lying flat in bed, drinking plenty of fluids, and taking pain tablets. Occasionally, additional treatment is needed if the headache persists. Also, on rare occasions, the numbness may extend to your chest muscles in the same way that your leg and abdominal muscles become numb. This may make breathing seem more difficult to you. Oxygen will be given to you if this occurs, in order to relieve this sensation and to aid your breathing. Another rare adverse reaction can occur if the special epidural needle or catheter enters into one of the swollen epidural veins. Just like varicose veins and hemorrhoids, these veins can become quite large during pregnancy. To avoid this unusual reaction, the anesthesiologist at the beginning of the block may give you a small test dose of medicine and ask you to report if you notice any dizziness, a funny taste in your mouth, a rapid heartbeat, or sudden numbness. It is very important that you communicate thoroughly with the anesthesiologist and relate any reactions you may be experiencing. In order for this video to be used for consent purposes, essentially all risks that have been reported in our literature through the years must be listed. This is absolutely not meant to alarm or frighten you. The purpose is to fully and completely inform you. These other rare complications include, but are not limited to, infection, bleeding, seizures, nerve damage, cardiac or respiratory depression, and death. Though most of these adverse reactions are uncommon, an anesthesiologist or a CRNA will be with you to evaluate your special needs. These medical professionals are well qualified to assess which safety precautions are necessary to avoid and treat complications related to the labor and delivery procedure. If you, your anesthesiologist, and your obstetrician decide that an epidural anesthetic is the best choice for you, it can only be administered once you are in true labor. After you receive the initial epidural medication, the effect on labor can vary significantly between one person and another. Each mother responds differently. Some may have a brief period of decreased uterine contractions. However, many are pleasantly surprised that after the epidural medication has made them more comfortable, their labor actually speeds up. By decreasing your general discomfort, the epidural medication allows you to rest while your uterus continues to labor. The most strenuous part of labor occurs when the cervix is slowly opening up to allow your baby's head through. Because of your ability to rest during this period, you should have energy, allowing your delivery to proceed when your cervix is completely open and it's time for the baby to emerge. The epidural block at this time should reduce the pain while allowing you to still push when needed. The primary advantage of an epidural anesthetic is that it allows you to remain alert and to enjoy the birth of your new child while being comfortable. The epidural does this without affecting the baby. Occasionally, a cesarean delivery is necessary. This is performed surgically through an incision in the lower abdomen. The reason for having a cesarean delivery is normally due to certain details in the medical history of the mother, such as an abnormal pelvis or a previous cesarean. This would be called an elective or planned cesarean delivery. An emergency cesarean delivery would be performed if a significant problem occurred during the labor that required urgent or emergent delivery of the baby. For cesarean deliveries, 3 primary anesthetic choices are available. If you already have an epidural catheter in place and suddenly you need a cesarean delivery, the anesthetic block usually can be extended to numb the entire abdomen by giving stronger anesthetic medicine through the catheter. This would still allow you to stay awake and see your baby at the time of delivery. Rarely, it may not be possible to utilize the epidural catheter that is already in place because of the urgency of the situation. Spinal anesthesia is another anesthetic choice. A very small needle is placed in a similar location in the back as in an epidural block. The primary difference with this anesthesia is that a much lower dose of medication is needed, since it is injected directly into the sac of spinal fluid rather than into the epidural space. Numbness develops very rapidly following the injection. Rarely, a headache may occur following a spinal anesthetic. If the headache persists, it may necessitate more treatment in the same manner used for headache following epidural blocks. General anesthesia is used when a regional block-type anesthetic, such as an epidural or a spinal block, is not possible or is not the best choice for medical or other reasons. General anesthesia can be started very rapidly and is commonly used when an urgent or emergent cesarean delivery is required. For example, it would be used if the baby developed severe distress or if the mother suddenly had profuse vaginal bleeding. Under these circumstances, general anesthesia can be the safest choice for the baby, as well as the mother. The most significant hazard associated with general anesthesia is the presence of food or liquids in the mother's stomach. Labor normally causes undigested food and acids to remain in the mother's stomach. When the mother becomes unconscious, these can back up into the mouth and flow into the lungs. Your anesthesiologist will take extra precautions to protect your lungs by placing a breathing tube into your windpipe after you are unconscious. You may also be given some antacids to neutralize stomach acids before a cesarean delivery. However, it is best to remember that in all circumstances, once your labor pains begin, you should eat or drink nothing, regardless of what type of delivery you have planned. Sometimes during labor, small sips of water or ice chips are permitted by your physicians for your comfort, but these must be kept to a minimum. Your anesthesiologist is a physician specialist, just like your obstetrician or your pediatrician, and you will receive a bill for anesthetic professional services provided to you. If you have any financial concerns, your anesthesiologist or an office staff member will help to answer any questions you may have. You will note that the hospital will charge separately for anesthesia equipment that is used. These are sometimes listed as anesthesia charges. In conclusion, modern anesthesiology offers choices for a relaxed and enjoyable childbirth. Anesthesiologists and CRNAs, it is our goal to make your birth experience as comfortable and safe as possible for you and your baby.